Hello, everyone. Thanks so much for joining us today. We're really excited to share this new program with you and the context for its creation. My name is Megan Bedford. I'm Vice President of Content and Marketing for Quality Interactions, and I'm joined by our leader, Michelle Corton-Brown.
Hi, and
Uh, Michelle will get started in just a second here, but I wanted to do a bit of housekeeping and let you know that this is a live event. All participants are on mute, but we do invite your questions in the control panel. We'll try our best to get to those at the end of the session. And you're also welcome to reach out to me by email at mbedford@qualityinteractions.com. But let's get started. Michelle, I wonder if you could frame for us the genesis of this package.
I'm happy to. And I just want to add my welcome to all of you who joined us today. Um, over the last 15-year arc at Quality Interactions, we have really prided ourselves in the fact that we've been able to listen to our clients and really use their voice to help us create new products and services. So we're really meeting demand. About 18 months ago, we heard about an emerging demand for what I'm going to call power skills, training around empathy, cultural agility, among other things that really stand alongside technical skills that are required to do the job. We began working to create this product in partnership with a leading university that I'll talk about a bit more. But then, 2020 hit. And recent events, including the COVID pandemic, which really illuminated for lots of people in our country the issue of health disparities, and the national response to the unjust deaths of Black men and women in this country, have both shaken our country and I think created for our health system an imperative. Our nation now knows what many of us on this phone already knew, that it was time to take a stand toward achieving health equity. We simply can't wait a moment longer. This is our time for actionable, meaningful change. And it really served as the impetus, these two things happening in tandem for the product that we're delighted to share with you today. Our solution is to skill up. And we really used as the goal to offer a comprehensive solution aimed at supporting clinicians who have a deep commitment to closing this health disparity gap. It is a skill up at home solution and an essential ingredient to ensuring high level of cultural competency in your practice. What's more is that we're creating an impetus for you to demonstrate to colleagues and in professional settings your credentialing around this space. Before we go too much further, I wanted to just give you an introduction to Quality Interactions for those of you who don't know us very well. We were founded by 3 practicing physicians who saw a firsthand need to improve cross-cultural communications in healthcare. Their pioneering research in cultural competency has been realized with an extensive catalog of blended learning solutions, e-learning, live learning, and the combination of the two. We're also a certified minority business, and we have trained over 250,000 healthcare professionals in the country at some of the largest hospitals, health plans, and medical schools here in the US. Despite the fact that our courses are typically required by managers, we've consistently received positive ratings, with over 90% of learners agreeing that their skills that they've learned through our training will impact how they deliver services and care. We think that's a pretty powerful statement. And here you see just the range of clients that we have had the privilege of working with over the last 15 years. So now we come to the product that we have launched, which is an online certificate in cultural competency. And it really represents an exciting turn for us in that we focus closely on our end consumer, our learner, and partnered with the first academic institution to achieve Planetree recognition in advancement of person-centered healthcare. And that partner is National University. For those of you who may not be familiar with Planetree, it is an international association that provides an accrediting process for hospitals and for medical centers who focus on person-centered care. In partnering with National, who went through a highly rigorous process to achieve this accreditation, our learners will receive 1 CEU from the university, in addition to 9 continuing education credits through the ACCME or ANCC board of your choosing. Megan, perhaps you can share a bit more now about what learners will find in the program itself.
Yeah, thanks, Michelle. So what I want is to first share this quotation. It's a testimonial from one of our learners that I think is really at the heart of the program. What I read here is that the journey is really never done. And particularly in the space of cultural competency, there's really room to grow all the time. What I read here is that, you know, a person who's been highly dedicated to the patients or people that they serve can always learn more and can always serve better. So what we really wanted to do was offer a comprehensive solution wherever you are on the spectrum of your career that allows you to really feel confident and continue to grow as a leader in the profession. So what does that look like? You see here a structure of what the 9 hours of accredited e-learning, and as Michelle pointed out earlier, National University also offers 1 CEU for completion of this program. If you start with the self-assessment bar there, we have an assessment that both begins the program, ends the program, and is then offered again 3 months after the program to really test the efficacy and find out how people are using this content. Beyond that, once you get through that first initial self-assessment, we start with some basic cultural competency, and I say basic with a grin on my face that you can't see because there's really nothing basic about cultural competency. It's a very, it's just such a rich and rewarding study because it is no one thing, right? We're always presented with a unique person, and there's no answer that you can have ahead of time. What you do is you develop your skill set around asking the right questions, uncovering issues, responding, and engaging. So what we do in our foundational courses is really teach that approach, teach a foundation to how to recognize where a patient's perspectives might be different, figure out how to engage them around that, and how to engage them in their care. We also have a really excellent unconscious or implicit bias course that introduces participants to the concept, and an improving adherence course that, is again just a really nice foundational piece. We've got 4 population health topics that come after that. Also e-learning. We have an LGBTQ course that was just recently re-released this month. A course in the Hispanic Latino population, Medicare population, and individuals with disabilities. We also have crafted, especially for this program, a couple of master classes with 2 of our co-founders, Dr. Alexander Green, who's speaking about limited English proficiency and how to engage interpreters effectively, particularly how to even think about expanding their role beyond just basic interpretation, and Dr. Joseph Betancourt speaking about social determinants, or what he calls social drivers of health. We furthermore have a directed reading section that connects a lot of the sort of foundational cultural competency topics that you'll find in our courses with what's happening right now with COVID. And then of course, once you get through all of that learning, you have the self-assessment again. I think, we'll absolutely see a lot of confidence in the post self-assessment. And so that kind of encapsulates basically the pathway, if you will. What I want to highlight is that everything that you'll find in quality interactions, products, and learning is person-centered. And so probably most of you on the line understand what that means, but let me just offer a little bit of a definition in case it's new to you. Really, this is the umbrella. And to get back to some of the things I mentioned earlier, cultural competency is not about learning about any culture that you could potentially encounter. That by nature is really how stereotyping happens. But you instead learn to ask the right kinds of questions and respond in ways that allow the patient to engage with you, the provider, so that you can ultimately determine a path that's going to help them be a partner in their own healthcare and realize better health outcomes. So it's really looking to each person who walks in the room as a unique person and feeling equipped to engage that person. And so what we do is we teach skills and approaches to making sure that providers are really ready to have those conversations and don't make assumptions or about where a person is or isn't at. So if you think of that as the overarching umbrella, what we have is this curated experience that is 100% online, housed on our best-in-class LMS. That's a learning management system, and I'll show that to you in just a second. I'm going to do a transition here so you can actually see what our LMS looks like for the learner. But it's really learner-centric. It's a user interface that's pretty intuitive to use. And while we do offer e-commerce, many of these courses that are in this package, this is a unique opportunity to experience all of these as one individual package. Not all of these courses are available for purchase online. So to recap, that's 7 e-learning courses, 2 master classes, a directed reading study, as well as the self-assessments. All of the e-learning courses, I should mention, have pre and post tests, and that adds up to 9 continuing education credits, CME or CEU from the ACCME or the ANCC, as well as the CEU from National University. It's priced at $750. And so let me do a quick transition here. Bear with me. Okay. What I pulled up here is the learning management system. So you'll see that I've already been in here as a learner. You can see that I've completed 14% of the overall program, and I want to pick up where I left off. So I will resume. And I hope this isn't too slow. My internet is not working with me today. So I'm going to bring the volume down. We've got optional audio narration. This is our rescue model course. It's the foundational cultural competency course. This is our clinical version. We also offer versions for non-clinical learners in different settings, hospitals and health plans. So where we come in, I've skipped over a couple of the welcome slides and the pre-test, but at this point now, we're looking at some of the basic facts that serve as something of a call to action. And I want to highlight that the structure in our courses typically follows a pattern of what does the data tell us? What is our call to action? Why are we learning about this? What can we do about it? What's a skill set that's actionable that we can actually employ in our real day-to-day job? And then let's have an opportunity for practice. So we use real patient cases for that skills application, and that's a structure that you'll typically find in every course. So data, skill set, practice. So I'm just going to quickly click through. I'm not going to spend time on the actual content here. I just want you to get a sense for how the course moves. So in this course, again, we're opening up with some data. We're going to present the rescue model to people, and I want to highlight, so I'm skipping ahead on the seek bar, which is a little insider trick, but you can't skip ahead in the course until you've actually been through the content itself. So we talk a little bit about the person-centered approach here. And again, this is the introductory lesson to the foundational course. Just for fun, actually, let me go back to this rescue model slide, and you can see what the other lessons are all about. The next lesson, respect diversity, we talk about, there's some brushstrokes of what is implicit bias, how do you avoid making assumptions, how do you show respect for diversity. The third lesson, communicate clearly. We talk about limited English proficiency, using interpreters, using plain English, what is health literacy, understanding differences, we have people kind of take stock of where they're at, and then also think about some of the ways in which an explanatory model can impact care. So what a patient's beliefs are as they come into the healthcare system. And then engage is a really nice opportunity to apply the concepts learned in the course to negotiate a solution that works for both sides. And that's really the end goal. So again, this is the foundational approach that then is represented or echoed throughout the courses, that we offer for further learning. So I'm going to skip back to our slide deck here for just a minute and pull this up. We are going to answer some questions now, but I wanted to make sure that anyone who has to hop off early has a chance to access the discount code we're offering through the end of August, and we will email this out to everybody at the end of the program as well. So it looks like we have some questions rolling in, and we had a few questions at the beginning of the session. I'm sorry, that were entered on the form. I'm going to turn my camera back on here. So one question that I just wanted to address, and I think I probably spoke to this fairly well during the presentation, but one person asked, why do we call this cultural competency? And I love this question because I think that, when our co-founders were starting this work and others were starting this work in other sectors so many decades ago, the work really came out of a firsthand need that they witnessed, which is that people, people's cultures impact how they access healthcare. And the more of a gap that you saw between someone's culture and then the sort of standard, the culture that a Western model would assume, the greater that gap, the more likelihood there was of a poor health outcome, greater likelihood for miscommunication, mistrust, etc. And so what they wanted to do was bridge the gap essentially and equip providers with tools and resources so that they could have these meaningful conversations. And again, this comes back to that person-centered approach where you learn a communication skill set to engage people. And so, that practice was called cultural competency. And I think we find ourselves now in 2020 feeling like, gosh, cultural competency makes it sound like something you learn about a culture and then you know what that culture is. We know, of course, that if we as Americans were in another country and somebody said to you, oh, look, it's an American, I know exactly what they think and feel. I mean, that's just ridiculous. Americans have so many diverse beliefs and values. You could never say that we are one thing. And so I say all that to say that, cultural competency might sound more fixed than it really is. Cultural agility is a term that is really popular right now that I personally love. But historically it was called cultural competency. And I do think that, if we think back to that learner quotation, that testimonial at the beginning of the program, that really captures the essence of the practice, which is ongoing. So that is a great question. I'm going to review some of these other questions that have just rolled in, but Michelle, I actually have one for you around implicit bias. And the question is, does implicit bias training really change people's actions?
That's a great question. And we believe that there's so much data out there about the fact that while many people do not believe they possess biases, there's a lot of evidence that in reality doesn't seem to stand ground. So whether it's the documentation on mortgage acceptance rates or approval rates, or the amount of medication that people who are brown or black get versus white patients, there's a lot of data out there that there are some implicit biases that exist. And so what we know for sure, that is, we don't have the conversation and we do nothing, then we are not really aiding and abetting a change, right? So implicit bias training is about disruption. It's about giving folks an opportunity to learn and grow, to understand the data that underpins implicit bias in our society, and to be reflective about strategies that can disrupt those kinds of behaviors that do in fact impact lives. Megan, we wait for another question?
Yeah, I'm going to feed one more your way while I jot down some of these other questions.
Sure.
Another great big question is, how do we make change on a wider level?
Well, that is a big, hairy question, right? And certainly there are organizations, institutions that we've had the privilege of working with that from a top down level have really made health equity a priority and a focus. And they've put it in a business as usual basis so that it's cooked into quality of care, it's cooked into the patient experience or the member experience. And we really applaud that. But we also recognize the power of one. And it really serves as the impetus for the kind of training that we're offering today. That if we can skill up and support ourselves, build our own capacities around these power skills of cultural agility and cultural competency, then the experience that members in a health plan or patients at a hospital have based on the training and the skills that people are able to develop, they'll have a different experience. And that really is, I think, the root of how change occurs.
Yeah, and Michelle, as you were answering that question, I was jotting down a note, a question that came in: is the course useful for managers supporting nurses? Um, and so to that end, I say yes. It's that in an exponential sense, that if you're a person who has the capacity to coach or mentor or guide, I will tell you that one thing, the self-assessment that's in this program is validated. It's something that we've used with organizations for quite a long time. And one of the things that I find over and over again reviewing the data is that people are rarely or never evaluated on their cultural competency skills. So, if this could become more embedded in managerial practice into the systems and structures of organizations, we would all be a lot better off.
Absolutely.
There are a few questions that rolled in that I can quickly answer. Yes, the deck that we presented today will be shared out. We'll be sending an email tomorrow to everybody who registered for the program with a recording of the event that you can share with anyone who wasn't here, with the deck, as well as that discount code. We had a couple people ask for the tuition amount. It's $750 for the nine accredited courses and master classes. And again, we have that 10% discount code that's good for through the end of the month for August. The master class, somebody asked, could you remind me again what a master class is? So we have the 9 accredited offerings. 7 of those are traditional e-learning courses. 2 represent delivered content from 2 of our co-founders, Dr. Green and Dr. Betancourt, on working with limited English proficient individuals and engaging interpreters. That one's presented by Dr. Green. And then 1 on social determinants or social drivers, as Dr. Betancourt calls it. So those are the master classes, and those are about an hour in duration. Both of those are also accredited for ACCME or ANCC credit. I also had a question come in around, are there assessments within the courses themselves? And the answer is yes. There's a pre and a post test with every single one of our accredited courses outside of that self-assessment that bookends the experience overall. So I believe I have gotten through. I have who is providing the accreditation and what areas of practice. So the ACCME and the ANCC. So you can choose your path if you're depending on your clinical professional experience, if you prefer the CME or the CEU. So I believe we've gotten to most of the questions. Again, if you would like to reach out to me afterwards, you're welcome to do so. Tomorrow's email with the content will be coming from me. Again, my name's Megan Bedford, and my email is mbedford@qualityinteractions.com. Thank you so much, everyone, for being here.
Thank you so much for joining us today. Bye-bye.
Thanks, Michelle.
Bye-bye. Bye, Megan.